Hello, good afternoon, everyone. Carlos Nati, Chairman of the Education Panel at the Society of Occupational Medicine. Thank you for joining today's webinar on the health of healthcare workers. It's my pleasure to introduce Dr. Dhruti Ngojilo, an occupational medicine specialist with the WHO's Global Occupational and Workplace Health Program. She plays a key role in developing and implementing health and safety programs for workers. Before joining WHO, Dr. Ngojilo worked with Tanzania's Ministry of Health and served as an advisor to the Workers' Compensation Fund and the Occupational Health and Safety Authority. She trained in occupational medicine at the University of Cape Town and is a fellow of the College of Public Health Medicine in South Africa. Please join me in welcoming Dr. Ngojilo. Over to you, Dr. Ngojilo.
Thank you so much for your kind introduction, but as well, thank you for the Society of Occupational Medicine for inviting WHO to provide this webinar, which is very key and important topic for WHO as well. So before I start my presentation, we always like to start with this nice video message from the WHO Director General, who stresses the importance of protecting health workers, how this topic is important for WHO as well.
Dear colleagues and friends, during the first 18 months of the pandemic, an estimated 115,000 health workers died from COVID-19. Many more suffered physical and mental health problems because of their work. Far too few healthcare facilities have occupational health services to protect their workers. More than 1 in 6 countries lack policies on worker safety in the health sector, and in Africa, less than 1 in 10 health workers are vaccinated. Protecting lives and livelihoods means protecting those who protect us. It means a healthier world in which our air, food, water, and working conditions nurture health instead of harming it. It means a safer world where governments, businesses, and labor unions work together to prevent, prepare for, and respond to health crises without jeopardizing health worker safety. And it means a fairer world in which all working people can access the occupational health services they need and work without risking their health. WHO and ILO will continue to provide guidance and assistance to countries to implement occupational health and safety programs for health workers. We count on your support and partnership in our efforts towards healthier, safer, and more resilient workplaces everywhere. I thank you. Dear colleagues,
thank you, Dr. Tedros. So we like to play this message, not because he's the Director General, but because his message resonates with most of us. So as he's mentioned about during the COVID pandemic, as we all remember in 2020, health workers were a subject in all the media, frontline page, clapping everywhere for health workers, calling them all sorts of names, heroes, and all big names, and praising them. However, we're now down to 2024. COVID-19 pandemic has been declared over, and health workers are almost forgotten, and this is unacceptable. So now the world is moving towards post-pandemic planning. How do we prepare for the next pandemic? And all these plans, surprisingly, are leaving out health workers. So everything is included, from making health facilities more climate resilient or not contribute to the carbon footprint, but then we are forgetting the key people who are important in this health system, or the backbone, who are the health workers. And we think this is unacceptable. So the health sector is among the most hazardous sectors, and it's a myriad of occupational hazards that health workers are grappling with, from occupational infections, musculoskeletal issues, from unsafe patient handling and other ergonomic risks in the health sector, hazardous chemicals such as cleaning agents, mercury, cytotoxic drugs, etc. All these affecting the health and safety of health workers. Also radiation for the radiation workers, psychosocial risks and mental health, which are major issue, violence and discrimination from health workers, from patients who come to the facility. So all these are affecting health workers, but also the risks in the ambient environment. So thermal stress, heat stress for the health workers, which is also a big issue, not only for the health workers working in environments where there is high ambient temperatures, but also from the personal protective equipment. Health workers wearing coveralls are subject to, at risk of having heat stress, but also occupational injuries and also environmental hazards. So WHO has developed an e-tool with key recommendations from WHO and ILO on how to control these key hazards, and this is available on the WHO website. So I encourage you to visit the WHO website and look at these key recommendations, and maybe you can provide also with your feedback on how you interact with this e-tool and how it's useful in your workplaces. So these are some of the key statistics that shows definitely health workers are at high risk. So 41% of health workers are exposed to hepatitis B, hepatitis C, and HIV globally, and this results to 12,000 cases of infections every year. Despite this, only less than 18% of health workers have been vaccinated against hepatitis B, and this is unacceptable completely. More than 50% of health workers in low and middle income countries have latent tuberculosis. And in 2014 to 2016 Ebola outbreak in West Africa, the risk of infection in health workers was up to 30 times more in the health workers than the general population. And as we see in the COVID-19 issue that we are seeing now, in the Ebola outbreak, during that time, everyone was again clapping for health workers, thinking about health workers as these heroes. But then after the outbreak was declared over, health workers were forgotten. And in some of these countries in Western Africa where there was an Ebola outbreak, currently they don't even have the basic means to protect health workers. Some of these countries not even have social protection. So a health worker, maybe if a health worker gets injured at work, or even if they get sick, there's no mechanism to assist them. So other health workers must come together and contribute money to take these health workers to hospital, and this is not acceptable. So I've spoken about COVID-19, but another issue is chronic low back pain. Up to 80% of health nurses in clinical settings having chronic low back pain, and what we see is this is one of the major reasons for health workers leaving the health sector, other than the low pay and poor working conditions. Mental health, as I've mentioned, suicide rates are very high in medical professions. During COVID, we had issues of depression, anxiety, insomnia, and violence as one of the major issue. In some instances, over 100, up to 100 health workers reporting having some form of violence, be it physical or verbal or sexual. So why is it important to protect health workers? So first, it is for regulatory compliance. The health sector as an employer has responsibility in terms of occupational safety and health laws to protect its own workers. So that's a duty of care of an employer, and the health sector must comply to this regulatory requirement. But secondly, it is protecting health workers has been shown to improve quality of care and also patient safety. So it's not only for the health workers, but also for the patients in the health sector. It's also important for increasing the resilience of the health systems in the outbreaks and public health emergencies. And we've seen this during the COVID-19 pandemic, where countries that had programs or policies for protection of health workers, they were able to act quickly and provide measures for protection of health workers compared to those countries that did not have such measures in place. So when the program is when an occupational health program is in the health facility or in the health system for protection of health workers, the system is resilient against public health emergencies. And also the occupational health and safety in the healthcare stimulates the retention of health workers because that improves their working conditions and they feel cared for and they remain in the health system. So in response to all this, WHO and ILO in 2022 published a guide on development and implementation of occupational health and safety programs, urging countries to scale up the protection of health workers. And this guide provides key recommendations on how to develop, but also to implement these programs in the health systems. And the messages from the guide can be summarized into these 5 key points. First, occupational health and safety programs should be developed and implemented continuously at the national, subnational, and facility levels. And this will entail introducing new and updating existing regulations, standards, and codes of good practices for protecting health workers. So what we see in countries is that some countries have regulations, but these regulations exclude health workers or they don't adequately provide protection for the health workers. And some countries do not even have such policies in place. So the guide urges countries to introduce these policies and regulations or updating the existing so that to ensure health workers are adequately protected. Also, to ensure that occupational health and safety becomes part and parcel of management of healthcare at all levels. So again, the recommendation here is to ensure that health and safety is part of the management objectives in the health system. So what we see is when we discuss with other sectors, for example, mining, manufacturing, occupational health and safety is part and parcel of the management objectives. The same way we deal with finances and other objectives, occupational health is part of that discussion. But surprisingly, in the health sector, this is not the case. So it's important that this is included in the discussion and be seen as one of the managerial objectives. Health workers should have access to competent occupational health services, and that's the whole breadth of services from prevention, treatment, and rehabilitation. And also synergies are needed between occupational health programs and other programs for collaboration with other stakeholders and employers and workers. So these programs or the protection of occupational health and safety for health workers is guided by 5 key principles. And the first is a shared responsibility between employers and workers. So employers have the duty and responsibility to ensure that there's occupational health and safety in the health sector environment. And on the other hand, workers have the responsibility to comply with the occupational health measures. But on top of that, health workers have the right to remove themselves in working conditions that they feel or they believe that it is risky to their health and safety. The second principle is synergy. There has to be synergy with other programs, as I've mentioned before, quality and safety of care, health workforce, infection prevention and control. And this is important because some of these interventions that are recommended in occupational health may have some similar recommendations or intervention in these other programs. So it's important that these programs speak to each other to ensure that there is collaboration, and because majority of what we see in countries is that there's not enough resources to provide the services. So it's important that if there's some resources available for example, quality of safety of care or health workforce, and they cover some aspects of occupational health and safety, then if the occupational health and safety program speaks to this programs, then there will be some streamlining of such services. So another issue is inclusivity. The occupational and safety program should be gender responsive, understanding that more than 70% of health workers are women, and these programs should cater for the needs of the women in the health sector. But also there are majority of workers that are immigrants. So it's important that also these programs are inclusive, not excluding the immigrant workers that are forming a majority of health workers in some countries. The programs should be sustainable to ensure continuous protection, not only when there's no public health emergencies. So these programs should be sustainable even during public health emergencies. And the importance of continuous improvement dialogue between employers, workers, and other stakeholders is also very important. So the reality is currently only 1/3 of countries globally have national policy instruments to protect the health and safety of health workers. And this is 8 in the WHO Afro region, 6 in the America, 2 in EMRO, 7 in Euro, 1 in Sierra, and 4 in the WIPO region. And WHO and ILO are working very hard with the countries to provide support so that these numbers are increased. And currently we are monitoring these numbers. I'm using an indicator in the WHO Global Health Observatory, so you can go and see these numbers, but just to show that there are some impetus from countries to develop these programs, and these numbers can increase in the near future. So based on these countries that have these programs in place, WHO and ILO have looked at have come up with the key elements of occupational health and safety programs for health workers at the national and at the subnational level and facility levels. So at the national and subnational level, there has to be a national policy statement on occupational health for health workers, and this is the key guiding document that will steer the occupational health and safety program. Then there has to be a person or unit in charge of occupational health and safety within the Ministry of Health, who is in charge of occupational health and safety matters and the focal point at the national level in terms of occupational health and safety. There has to be a multi-stakeholder national steering committee, which provides support to the national unit in charge, but also steers the program at the national level, regulations and standards, as I've mentioned before, but also information and research to be able to ensure that the recommendations that are put in place are actually evidence-based. Then there has to be adequate human resource for occupational health and safety for health workers, ensuring that there is a whole breadth of specialities, so occupational physician, nurses, hygienists, economists, but this to cater for the needs of the health workers in the health facilities. Adequate supplies and commodities for occupational health and safety available at all levels. Mechanism for financing of occupational health measures. So what we see in countries is there's support from maybe a donor supporting these programs, and then when the donor pulls out, then the program falls apart. So it's important that there's mechanisms for efficient financing for these programs that comes from the budget in the health sector, so that there's sustainable implementation of these programs. Then the service delivery, standard provisions for occupational health services, ensuring the quality assurance, and also expansion of these programs, not just at referral hospitals, but also down to the primary healthcare levels, and also policies for provision of support services for common infections such as TB, HIV, and hepatitis B. And then at the facility level, there has to be a policy, a facility policy for occupational health and safety at work, a facility focal point for occupational health and safety, who is well trained and understanding the needs and the occupational health needs of health facility, of the health workers at the facility, conducting regular risk assessments, putting in place effective control measures for occupational hazards, establishing joint labor management committees at the health facilities for health and safety at work. There has to be mechanisms or interventions in terms of facility personal hygiene and also safe waste disposal at the facility. There has to be a program for training of the health workers, but also the labor management committees. There has to be occupational health services, like I said, from early detection, diagnosis, treatment, care, up to notification and support for occupational diseases and injuries. Immunization of health workers. What we see in some countries, there is a program for immunization, but then health workers have to pay for it, for some of these immunization. But it's important that these immunization are provided first risk-based, based on the national immunization policy, but on top of that should be at no cost to the health workers. Has to be mechanism to record, investigate, and reporting of incidents and cases of occupational injuries and diseases. And in line with that, a system for collecting, analyzing, and reporting data that will promote health and safety at work. So those are the key elements of the program at the national and subnational level. And then based on the guideline that WHO and ILO developed, it also provides the guidance on how to develop and implement this program. And this again is based on the experiences that is drawn from the countries that have these programs in place. So these steps have been divided into these three major steps. So the first one is preparation, where the country is showing interest in developing this program and in the preparation of developing an occupational health and safety program. First recommendation is to build political commitment. And this is to ensure that from the get-go, there is leadership at the highest level in the Ministry of Health. For example, the Minister of Health is committed to protecting health and safety of the health workers. And then after ensuring that there's political commitment, then the assessing the current situation. So looking at what, in terms of those 13 elements that I've shown, at the facility level, those key elements, to look at which of these elements are in place and which ones are not. And it could be that some of these elements are within other programs, like I said, the synergies between infection prevention and control, health workforce, and other programs. So it's important when assessing the current situation to understand which of these elements are available and where they're available, and the adequacy of protection based on the available intervention. And then establishing a task force that will steer the development and implementation of that program. So that is the preparation stage. And then it's in the development stage, then the task force will write the first draft of the program, then carry out a feasibility assessment based on that first draft of the program. Then after carrying out the feasibility assessment, then coming back to the drawing board with the stakeholder, looking at the first draft, developing a second draft based on the results of that feasibility assessment. And then after the second draft, then finalize it, obtain approval, preferably from the highest level, again, Minister of Health or Permanent Secretary of the Health Facility, of the and then publication, and then dissemination. So after the program has been published, disseminated, then it's the implementation of the program, and that will involve developing plan of actions for implementation, understanding who needs to do what, and then the developing timeline for the development of for the implementation of the program. Then arrangement for external inspection, audit, and licensure. So these are some of the ways some countries have worked on how to implement the programs by including occupational health and safety in their mechanism for inspecting or auditing health facilities. And this seems to work very well, because then there's no, they don't have to create another separate mechanism for inspecting health facilities in terms of occupational health and safety. Then building capacities for implementation, ensuring that the human resource that is needed for protecting health workers is available. Like I said, physicians, nurses, hygienists, ergonomists, psychologists, etc. And then communication and technical tools for implementation. So the program is important that after it's been developed, it's adequately communicated so that health workers understand that there is a program in place for them. Because what we see again is when we go to to countries, is that when you speak to health workers and say, okay, we do have a program, occupational health programs, most of them, the first reaction is, oh, it's another program that we have to implement and we don't have resources. But once they realize that the occupational health program that is being advocated for is to protect their own health and safety, then they become it and want to implement it. So it's important that this program is well communicated to the health workers, understanding that this program is there to protect their health and safety. And again, the last is monitoring and evaluation and adjusting the program based on the results of the monitoring and evaluation. So based on these countries that we've discussed, we see that these programs definitely work, and they transform the health outcomes in the health systems. So these are the case study from Tanzania, which shows a timeline of when the program was developed up to 2021, when we did the analysis of the data. So in Tanzania, the program started around 2016 with just discussions between WHO, ILO, and the country, and the Ministry of Health. And as you can see, even during, when those discussions were going on, people were sensitized, and there were some improvements started being, showing. But the major improvements that, it's from 2019 when the actual policy was signed and published. And what we can see is the difference between regions that had an occupational health program and the regions that do not have an occupational program. And what we can see clearly is that with the regions that have occupational health programs for health workers, is there's higher uptake of hepatitis B vaccine among health workers, increased coverage with post-exposure prophylaxis for HIV, but also improved in reporting of cases against violence and harassment against health workers. So this gives us more encouragement to show that these programs do work and they do make difference for the health workers in the health systems. And on the other hand, failure to protect health workers has been proven to be very costly. So this is the study that was published last year, looking at the cost of COVID-19 infection for the health workers. And the numbers are very high, as you can see. And this is for countries that some of these countries are, low middle income countries where, they could use all the support that they need in terms of finances, and then they're using all this money to deal with something that could be preventable. So again, investing in health workers is a sound business decision. It lowers cost of occupational harm, which is estimated up to 2% of health spending, and also contributes to minimizing patient harm. So it is a sound business decision, and health systems should invest in protection of the health, safety, and well-being of health workers. And this data comes from the OECD countries. So I'll just conclude. So in conclusion, health workers are the backbone of health systems, but their health and safety is often overlooked. And then developing the occupational health and programs for health workers is an essential element for protecting health workers and also strengthening the health systems. And this is not just a moral obligation, it's a strategic investment for improving patient care, staff retention, but also the overall health system resilience. So here are some of the WHO and ILO resources on safeguarding health and safety of health workers. I've mentioned the e-tool on occupational health and safety that I've invited you to look at and engage with, but we also have a manual on occupational health and safety in public health emergencies, policy brief on national programs for occupational health and safety of health workers, a checklist that facilities can use to identify and prioritize areas of action for improving protection of health workers, and an open WHO course on occupational health and safety in the COVID-19, in the context of COVID-19. So this, while it says COVID-19, it provides general principles on health worker protection, even outside the COVID-19 pandemic. So I highly encourage you to take this course and learn more about how we can protect the health, safety, and well-being of health workers. Thank you.
Thank you so much for this wonderful presentation. I really, really enjoyed it. Many thanks. In particular, it's been ages I've been looking for some evidence on the indirect effect of occupational health services for healthcare workers on patients' care. And it seems you have done one in Tanzania. Am I correct?
Yes, yes.
Have you published it?
Yes, yes, it is published. It's the case studies in the WHO website. I will share the link to the.
Has it been published in a journal or perhaps?
No, it's just in a annual report, the WHO annual report, biannual report.
That's great. And can I ask when what's the date of that? When did you publish it? 2 years ago.
2022.
Okay, perhaps that may be the only one. I'm not aware of any other significant work in this field, and I believe our colleagues in the world of occupational health should be more proactive about that by making more evidence about how occupational health for healthcare workers could have an impact or have a positive impact on patients' care. Because to me, that's the most important point, to develop a sort of robust business case for the employer, in this case, the hospital, for them to fund us and for us to provide the services. Otherwise, it's always difficult to convince them when there is no strong evidence in this field. Are you aware of any other similar evidence, or is it the first one you have done it?
So for WHO, this is to my understanding, that's the first case study that we did. But we've been encouraging countries, because that was based on the data that is available in the health sector. So it's been routinely collected in the health sector. So the data is there. It's just for countries to extract the data and analyze and looking at the trends. Yeah.
And you mentioned about patients' care. Was it something subjective, or did you measure it objectively? Did you give a questionnaire to them, or was it something that something more objective, such as the health indicators?
Also, the case study that we did not include the patient care. It was only looking at the health workers. But
Okay.
but I think, yeah, it would be interesting because the that is available. I think, for example, in Tanzania, this data is collected every month, and they collect this data and they input it into the national system. So it will be interesting to also see, since the program started, if there's any improvement in the indicators for patient safety as well. But this data is available, and it's quite possible to do the comparison. Yeah.
That's great. That's great. Many thanks again. Let me see. Yeah, it seems, let's see if any question here. At the moment, there is no question. So if you don't mind, I want to use my veto right, and I ask my own questions, if you don't mind, until one of the attendees will put a question in the relevant section. Okay, so my next question is about consistency in OH practice internationally. What I see at the moment, even in the Western world, there is no consistency. Say, for example, the way we are practicing with regards to, for example, TB in the UK is a totally different ballgame compared to what our colleagues in America is doing, and even in other countries. And sometimes maybe completely the other way round. Is there anything WHO can do or can make some sort of recommendations in order to bring some sort of consistency in the practice?
Mm-hmm. Yes, no, absolutely. So I agree with you that there is lack of consistency. I mean, I will speak in terms of occupational health for health workers programs. So some of the elements that I've shown, some countries do have differences in how the implementation is conducted in one country versus some other countries, as well as the actual interventions that are happening. So what we've done is develop the guide that I've shown, which provides some sort of like a blueprint that the countries can use. So if you want to develop a program, these are the key elements that you need to have. If you want to, for example, appoint a focal point at the facility level, these are the competencies that they need to have to be able to provide that basic level service. So then countries will be able to measure what they have against what is recommended, and then maybe there will be some consistency. And what we see even with the developing of the program, some countries that are now developing their program, they're actually using this blueprint, as I might say, that we have this guide, and they assess themselves against this the recommendations. What do we have? And then they developed the doc based on what is recommended by WHO and ILO, and hopefully there will be some consistency in the long term.
That's great.
Yeah.
Okay, let me check again. Let's see if there is any question there. Okay, at the moment I do not see any questions, so if you don't mind, I continue with a couple of more questions. The next one is about what do you think about, say, WHO will taking the lead on developing some sort of IT platform for occupational health, mainly for low-income countries? Say, for example, computerized psychological intervention, and similar type of input for healthcare workers.
Mm-hmm. Mm-hmm. Yes, no, absolutely. So like I've shown, we do have that e-tool that provides the recommendations, but we've also been working to develop, it hasn't come out, maybe we'll need to follow up, but there was a chatbot, a WhatsApp-based chatbot that we provided input for occupational health and safety, which also includes the mental health, etc. So ideally, what that chatbot would be is the person would just ask questions there about the issues, and then they will get recommendation based. But again, that will be based on what we have on the e-tool. So what are the recommendations for somebody will ask, say, infection, an occupational infection, what WHO says, so they can chat and get that information. So we do have some of that, but that chatbot we need to follow up maybe, but we started working on it with the IT people.
Okay, great. Many thanks. Let me check again to see if there is any question here. Okay. Okay, so I do not see any further question here. Just, the final comment from my side, as a consultant occupational physician who's been working in NHS for more than 20 years, and as an occupational physician with a special interest with international occupational health systems, basically, and having seen several, occupational health systems in different countries, I believe we have a very robust occupational health in the workers, mainly because of in-house NHS occupational health department. So if there is anything you feel we could be of any assistance in this field, personally, with my position at Imperial College, I would be more than happy to work with WHO, and I'm sure my colleagues here as well, they would be interested in contribute to any programs. So we would be delighted to work with you on any projects, and with the aim of basically improving health and well-being of healthcare workers. But many thanks again for your lovely presentation, for your time. I do appreciate it. And thank you to all attendees and audience as well.
There is
Anything
a question
from your side? Yeah.
There's a question in the chat,
Is there?
actually. Yeah.
Okay.
I'll just post it.
Thanks. Great. Okay. So yes, this one is Dr. Marwan Hamid. From your experience, what are the best measures can be used to prevent workplace violence, especially in healthcare facilities?
Okay. So yeah, thank you so much for that question. First, maybe I'll just address the comment that you made about your openness to support. Yes, WHO can use as much support as we can get from all our stakeholders, and including the Society of Occupational Medicine that we've been working with for a while, and we're also working with they're supporting getting funding and developing programs in other countries, Nigeria, Ghana, Uganda recently. So we could use as much support as possible from all of you. And coming to the violence and sorry.
Yes, the question is about,
Okay.
Can you hear me?
Yes, I can hear.
Okay.
Sorry.
So the question is about, based on your experience, what measures could be more effective in order to best manage violence in a healthcare setting?
Okay, so maybe I can share my screen quickly, because we do have from the e-tool that we do have recommendations for workplace violence in healthcare facilities. So I just didn't show that because of time, but maybe I can share quickly here. I don't know if you can see the my slide, but this some of the recommendations that the WHO has for preventing violence and harassment in the health sector. So improving working organization, so staffing levels are very important, working time, working conditions for workers, because some of the violence that's happening in the health sector is, for example, someone has a very long waiting time in the facility, and then they have the violence. So it's important to have optimal staffing levels, and that's some of the issues that are dealt with the health workforce program at WHO. Having buddy system, minimizing waiting time, providing information for the patients, restricting public movement in health facilities, preparing and supporting workers, for instance, so training workers in conflict resolution, managing assault, counseling, recognize dangers of violence behaviors, providing security measures in the hospitals, security escorts to parking lots, good lighting, security cameras, so things of that nature. So there are other general measures, responding quickly to incidents, encouraging reporting, confidential grievance procedures. And just to mention that currently WHO is developing a report on violence and harassment for health workers, and this will be published by the end of the year. So that will also provide more information on violence and harassment in the health sector.
Many thanks, very helpful. I'm looking forward to that report and to read it with great interest. Thank you again. Let me see if there is any other question here. I think, no, there's no further questions at the moment. So many thanks again for this wonderful, excellent presentation. And thank you to all the audience. Wishing you all a lovely afternoon. All the best.